Hello, my name is Michelle George, and I decided to take the initiative of doing my independent research project about the comparative analysis among emerging therapies for peanut allergy management. So I first recognized that peanut allergies and anaphylaxis are all vital to know about in the healthcare community because it is so dangerous. And because of personal challenges that I had with peanut allergies, I wanted to conduct this analysis to see what emerging therapies were available. So first I wanted to see how many people in the US have food allergies. So according to the Food Allergy Research and Education, they had researched that 33 million people, and as the years have progressed, more have reported to have food allergies. And about 75 to 85% of these pediatric cases where they are diagnosed with having certain food allergies, they persist into adulthood. But specifically, this project is about peanut allergies. So, what is a peanut allergy? A peanut allergy is a hypersensitive immune response that the body experiences when they recognize that the peanut protein is a foreign body and is recognize it as a harmful substance. So the human body then produces IgE antibodies that bind to these allergens, and this causes the release of certain chemicals called histamines. And histamines are chemicals in your body that are released as part of your immune response. And so this causes symptoms of anaphylaxis, which is a rapid drop in blood pressure. And so when this blood pressure gets dangerously low, so the blood doesn't flow from your heart to your brain, it causes bronchoconstriction, which is the swelling of airways, which causes a difficulty of breathing, as you can see in the picture here. And so the aftermath of an allergic reaction also includes inflammation of the skin and hives as well. So the most typical forms of treating a peanut allergy is mainly through Benadryl pills, which treats slightly to mild allergic reactions. And then you have EpiPen, which is the most common way to treat severe allergic reactions. Now, the EpiPen is a syringe that, as you can see in this image on the left, is injected into the muscle. So the EpiPen counteracts the vasodilation that occurs with anaphylaxis. Vasodilation is when the blood vessels widen too much, but with the help of this EpiPen, the drug can fix that and fight the drop in blood pressure by tightening these widened blood vessels to reverse the vasodilation. So while Benadryl and EpiPen are treating anaphylaxis after the whole reaction has occurred, I wanted to study the immunotherapies that would prevent the use of EpiPen and potentially be a cure for peanut allergies. So these emerging therapies include palforzia, omalizumab, and Viaskin peanut patches. So let's first start with palforzia. Palforzia is an oral immunotherapy, OIT, which consists of prepared peanut protein that is in powder form, and it is administered in gradually increasing doses to help the body build more tolerance. So participants usually undergo an initial dose escalation phase in a day from 0.5 milligrams to 6 milligrams. And subsequently, they proceeded from an increasing dosage every 2 weeks from 3 milligrams to 300 milligrams. And usually this was followed by a 24-week maintenance phase that had all the participants only have 300 milligrams of peanut protein. And after 52 weeks, a notable study that I had discovered was that 67.2% of actively treated participants were able to consume 600 milligrams of peanut protein, which is a huge improvement. Moving on to the next one, the Viaskin peanut patches, usually tested for ages 4 through 11, and it is an epicutaneous therapy which consists of 250 micrograms of peanut protein. And though it is not FDA approved yet, it is still in clinical trials, and it has shown drastic improvements in the people that were tested on. So from the papers that I read, there was usually a range of 150 to 300 children that were tested in a double-blind, randomized control setting. So the new data shows that among the 175 who wore the allergy patch for 2 years, 81% of those could consume 1,000 milligrams of peanut, which is basically 3 to 4 peanuts. And that is a drastic improvement from the 67% of people who were able to eat 1,000 milligrams of peanut protein only after 1 year of usage, as opposed to 2 years. And even though this is not FDA approved, it is expected to come into 2 to 3 years to be FDA approved. The next injectable drug is omalizumab, which is a monoclonal antibody that reduces the IgE levels in the body. And this is usually for kids that range from ages 1 through 17. And this drug helps suppress inflammation and histamines that often show results way quicker than the other two therapies. So, across the range of papers that I had looked at, around 500 people were screened and 200 people went under randomization. And usually, around the people from ages 4 through 12 were reactive from 500 milligrams or less of peanut protein they were tested. And in the 134 weeks, around 200 people that received 2,000 milligrams of peanut protein, and followed by 26 weeks of avoidance. And a result of that was that 71% of the group that was tested achieved desensitization versus in the placebo group, which is a drastic improvement as well. So, looking after all these immunotherapies, my conclusions for each therapy were that even though that each of them have drastic improvements for each person that they have tested, there are still pros and cons to each one. Palforzia, it improves peanut tolerance to about 1,000 milligrams, which is around 3 peanuts across a 12-month trial that I had researched about. And Palforzia, it is an oral immunotherapy, so our body ingests this peanut protein and it retrains the body in order to not react to it. And usually it is treated for children's ages 4 through 17, and around 600 milligrams are given to them. Now, the cons, on the other hand, is that it is a time commitment. Because it is an oral immunotherapy, you cannot take it just once every month or twice every month. It has to be every 2 to 4 weeks or even more often than that. Initially, when you start taking this oral immunotherapy, there may be abdominal pain and vomiting. That could be some side effects. And a big one that is a con is that it is typically very expensive. So its base price is $1,300, but it also varies for how long you're going to do the treatment for. For the Viaskin peanut patches, the pros are that it's minimally invasive, which is typically preferred by certain families because it does not hurt the child as much, and it avoids oral ingestion like Palforzia. Now, the cons, on the other hand, is that there is a lower efficacy rate compared to the oral immunotherapy. And because it's not into your body immediately, because you're not ingesting it, it is through your skin, typically there's more time that is needed to even show some level of progress. And it is actually very expensive. So it costs around $6,500 for just 365 patches. So it is definitely an investment that the family needs to put into this therapy in order to show some progress. Now, my last conclusion about omalizumab is that it is the fastest treatment with the most positive results, and it can not only be used alone, but it can also be used with immunotherapy. Now, the cons to this is that there's no set price since it is still in the clinical trials and not FDA approved, but it is typically around $1,500. Now, because this is an injection and not through your system, you're not ingesting it, it does not retrain your immune system to tolerate these peanuts. So once you stop the injections, maybe for like 24 weeks or 48 weeks, your IgE levels rise back again, and your body tends to receive these peanut proteins as it originally had with a severe anaphylaxis. So it's not as long lasting as Palforzia. And also, another con is that there is a big time commitment again. You cannot have injections once every year, it has to be continually every 2 to 4 weeks. So it's definitely investing a lot of time that the family has to do for their children or even for teens as well. Thank you. That's the end of my presentation. I also wanted to thank my mentor, Dr. Salman Hashim, for all the guidance that he has given me as I continue to work on this project. And I hope that all of you have learned more about peanut allergy management.
Thank you so much, Michelle. That I learned so much from that session. I'm excited as I know you mentioned you still have some work to do on your project. What are the next steps forward as you're continuing your research?
So definitely I want to sorry. Definitely I want to look at more papers and see what can I find. And then also do more of a comparative analysis, seeing the pros and cons of each one, and then making my own methods, like from all the papers that I had researched, and just crafting that research paper more. So that'll be my next steps.
And do you think any of these therapies could become standard practice soon, or do you think more research is needed on their efficacy?
I think for Palforzia, because it is FDA approved, there's definitely more papers on that, which I have found. And more people are willing to do that, especially because people are afraid of like some exposure, accidental exposure to peanut protein, especially because peanut allergies are so severe. The other two are still in clinical trials, so that's why there's fewer papers on them, but it is an emerging therapy and it has shown like drastic improvements, but also I do want to see them try it on different age groups as well. Maybe older, because I specifically researched from like young ages, like 1 years old to 17 years old. So I'd love to see them doing it on like 55-year-olds or older than that.
Yeah, I noticed there was definitely a common denominator in the age group for the efficacy. Were you noticing any differences in results or efficacy in treatments when it comes to different severities of allergic reaction? Is that something that was accommodated for in these studies?
Um, Usually like the younger babies typically have more severe reactions to it, especially because as your body grows, you build more immunity to certain proteins, so you kind of grow out of some like peanut allergies or allergies in general. So I have definitely seen more severe allergies in younger people, but also there have been some anomalies where like for an example, me, like I'm 16, 17, and I still have severe allergies as well. But based off of the papers that I had looked at, mainly babies and younger children have them.
Okay. And why were these three therapies what you chose to study?
Mainly because on the market or on PubMed, where I found all the papers, those three were the only ones. Um, as I said before, like Benadryl and Auvi-Q slash EpiPen, they're mainly used for common ways to treat the allergic reaction, but I really wanted to delve into what are the emerging therapies that could help with this peanut reaction, and that could potentially take away all of this, try to have a desensitization to it.
Yeah, wonderful. Thank you for sharing.
Thank you.
Any other questions from the audience for Michelle? All right. Well, Michelle, I'm excited to see where this work continues and appreciate you taking the time to share your findings.